Okay. Hi, I'm Dr. Tamara Bavendam, and I'm going to talk to you about a cross-sectional research study that we did exploring the relationship between physical activity and overactive bladder symptoms. This is a large cross-sectional study in 10,000 patients, an internet survey where they completed the LUTS tool, which assessed whether they had lower urinary tract symptoms. Patients that had symptoms of urinary urgency and or urgency incontinence were classified as having OAB, and subjects that had no lower urinary tract symptoms were classified as having no and minimal symptoms. And those two groups were compared based on their level of physical activity, based on some questions from the N. Haynes study. And also their levels of activity were benchmarked against 2008 and 2010 guidelines for moderate and vigorous physical activity. And what we found was that in patients that did not have overactive bladder symptoms, that their level of physical activity was similar to the general population, as you can see here. And patients with overactive bladder, this is men on this side and women on this side, their level of physical activity, whether the 2008 or the 2010 guidelines, was much lower, and this was statistically significant. On the logistical regression analysis, we found that in men, stress urinary incontinence was the biggest predictor of decrease in physical activity, whereas in women, the perception of urinating frequently was the biggest predictor of urinary incontinence in women. And we believe this data is very important because overactive bladder is often considered as a lifestyle concern, something that's not that important. You don't really have to worry about it, but this is clearly showing that patients with overactive bladder are not as physically active as they need to be. And hopefully this data will lead to further, more in-depth research that will help understand whether overactive bladder leads to decreased physical activity, or decreased physical activity contributes to the development of overactive bladder.